Hello, lovely viewers. This is your boy Evans, and you are watching your favorite channel, Low Budget Cooking. And on this episode, we have something that is more, let me say, it's mind blowing and mind busting. Someone came saying he wants 35 Ghana cedis and he is going to do something magical. I was really shocked, but as you know, on this channel, we give platform to everybody who can do anything, some shows and magical with the little amount they have. So I'm going to introduce our guest to you who needs 35 Ghana cedis to prepare something magical. Stay tuned. Viewers, we are back and we have our guest with us. So please, your name?
I'm Ken.
Ken. Okay, Ken. Good having you here on the show. So Ken, will you mind telling us what you like to prepare for us?
No, it's a surprise. So yeah, I just need the 35 CDs and then I'll do everything.
Okay, so Ken is saying he just needs the 35 Ghana cedis and he's going to do the magic. As you know, we are here. We are not scared of surprises. So we are going to make sure we find 35 Ghana cedis exactly. So he goes to prepare the food. So we have 35 Ghana cedis. And Ken is going to do the magic. Ken, so you have the 35 CD. Kindly empty your pocket or something so we see that you have nothing with you.
I have nothing with me. I'm going to do magic. I'm going to do magic.
Okay, sure. So keep watching and we'll be right back as we watch Ken do something special with 35 Ghana cedis. We are back and we have Ken here with the items. So Ken, kindly take us through the items you bought and the amount you bought for each and every item.
All right, sure. So I bought the rice for 10 CDs.
So rice 10 cedis, let's calculate it together.
Yeah. I bought the sausage 5 CDs.
So sausage 5 cedis, all making 15 Ghana cedis at the moment.
I bought the tomato too 5 CDs.
Tomatoes, how much?
5
5 cedis. So all making 20 Ghana cedis.
Oil too for 5 CDs.
So oil 5 Ghana cedis. We are getting 25 Ghana cedis at the moment. Okay.
Yeah. I bought this pepper 3 CDs.
So 3 Ghana cedis.
Yeah.
So 28 Ghana cedis.
The onion too 2 CDs.
So onion 2 cedis making 30 Ghana cedis. Okay.
Yeah. And then finally I bought the eggs too for 5 CDs.
So
Yeah.
eggs for 5 Ghana cedis. So in all 35 Ghana cedis. Okay, so what are we preparing with the items you have here?
Okay, so I'm going to prepare braised rice with these items.
So braised rice, Ashafo Amoche, if you don't know the meaning of braised rice, angwamo no patre, angwamo enimoko. That's what they call braised rice. So stay tuned as we watch Ken do the magic. Okay, so with the braised rice that you are preparing, Ken, what will be the first step that we'll be taking?
Okay, so I chopped my onions,
Okay.
and then now I'm moving to pouring the oil in the pan. The onion is fried, so
Okay.
I'm pouring the rice.
So we are still with Ken in the kitchen preparing braised rice. So Ken, what's next?
Okay, so as we all know, salt is everywhere. So although the salt was not part of the budget, but we still have to put in salt. Okay.
So viewers, as you are watching, salt, if you don't have, you can visit a neighbor and get a salt so that you prepare this sumptuous meal with 35 cedis, or you can even omit 1 egg and buy salt. So you are going to get only 1 egg. But instead, Ken is using 2 eggs and he brought his own salt to the kitchen. Stay tuned as you watch Ken prepare braised rice, aka Angwamo, SK, the local food that you know. Ken, there's this thing that we do on the show where you be asked some few questions about yourself and any random question like a general knowledge question and stuff. So, shall we begin?
Oh yeah, yeah.
Uh, a student of University of Ghana, right?
Yes, please. Yes.
Okay, so which level?
I'm in level 300. Yeah. I'm in
Level 300. Reading which course?
I'm doing medical imaging.
So medical imaging.
Yeah.
Is it visual or something?
Oh no, no. It's a health related program.
Hey, sir.
In hospital, doctors can't work alone. Okay, they will need other health professionals to make their work easier for them. Okay, so when you come to the hospital, sometimes some patients may be having issues with tuberculosis and chest pain, and also the patient will be requested to take a chest x-ray, or sometimes let's say a road traffic accident, someone got their head injured, to check if there is any cranial let me calm down to
Come down
the
to my
audience.
level. Yeah, me, I'm a level. LCM, least common multiple.
So if let's say there is blood flowing in, like there is cranial bleeding, like moja nyunugu nipane tirima, yeah, the person will be requested to do a CT scan. Yeah, the CT scan is a when it comes to the medical term, is computed tomography. Yes, so that will determine if there is any cranial bleeding or something.
So let me say
Yes.
you are responsible for the scan, this X-ray and
Yes,
things.
please. X-ray, CT scan, MRI, theater, radiography, and then ward radiography and all. Yeah.
Oh, okay. And so what's the name of the program again?
Medical imaging or diagnostic imaging. Yeah.
So medical imaging, viewers, I was confused. When I heard imaging, I thought visual art. So that's why I asked visual art. Oh, okay. So the people you see responsible with the X-ray, the photos that come out and all those things. So you are responsible for that.
Yes, please. So we take those images for accurate diagnosis.
Today we have really been educated. So as you know, it's not doctors try like that. So we have they have specialized doctors. So you are your doctrine aspect is photography. So let me say photography. Yes. Will you advise anyone pursuing a course that is more demanding to go into boyfriend girlfriend, or to you it's a no?
Oh, for me, if you can blend the two together, fine. Why not? You can do it. But for me, Charlie, I'll see.
So is it also true that people pursuing these demanding courses, they go in for ladies who are doing the theater arts, the dance, those things? Is it true? How true is that one too?
Oh yeah, it's true. It's true because you see, most of the time, like two guys in the same work field, or like in the same department, doing this boyfriend girlfriend, it will be very stressful. And then because they are all aiming on one particular thing, like you see, time, like they won't get time for themselves. So it's like they would want to go to other departments to get their partners from there.
Ken, if you have to take a girlfriend, which department are you going to take?
Charlie, this question there is very tough. Oh. Well, I'll take it from the sciences here. The sciences here.
So Ken is saying if he wants to go in for a girlfriend, he's also going to take someone who is in the science field. So moving away from your course, why did you take on this challenge? Because you someone who is doing something relating to science, you then can budget if I'm is someone who has to be doing accounts, who should be thinking about management, how to manage his resources and stuff. So with someone who is doing something related to science, why did you take on this challenge?
Okay, so basically, for me, I like cooking a lot. Okay, I like cooking a lot, and then because all my siblings are girls, they are girls. Like I really love cooking and all. So I barely buy food on campus.
Oh,
Actually,
okay.
yeah, I barely buy food on campus, and then I think cooking is one of my hobbies, and then
Okay.
yeah. I don't like football, so yeah, I really like cooking. Like I like cooking a lot.
Okay. So, Ken, do you know that people say that, as you said, you don't like football? They say people who don't like, or men who don't like football, they are actually women. How are you going to justify that one too? And what is your reason for not liking football, if I may ask?
Well, if they say that, it's up to them, because I don't know the reason why someone not liking football is classified as a woman or a lady or a gay. Yeah,
Okay.
I don't like football. I just don't like it.
You just don't
Like
like the sport.
yes, yes,
So,
I just don't like it. So yeah,
so yours is just to be in the
but
kitchen.
I like basketball.
You like basketball,
Yeah,
okay.
I like
Do you know
basketball.
how to play basketball?
Oh yeah, very well.
Oh, okay. So who is your favorite basketball player?
Kobe Bryant.
So Kobe Bryant is your favorite basketball player. Oh, okay, sure.
So I'm almost done with the pepper grinding, and then after that I would like to fry the sausage and then the eggs, and then yeah, I'm done.
Oh, okay.
Our rice is almost done, so yeah.
So Ken, have you ever tried this process before?
Uh, yeah, I've tried it before.
So
Yeah,
it's
I've
something that
tried
you
it.
usually do.
I don't usually do, but I've done it before.
Okay.
Yeah.
So what is your favorite meal that, if you could recall, that you prepared yourself? So one of the best meal you prepared yourself.
Okay.
And why do you classify or say it to be your best food?
Okay, so there's this time me myself, I didn't know like my food is nice like that. So
Okay.
yeah, there is this time I prepared rice and kontomire stew. Yeah.
Okay.
So yeah, I invited my roommates to taste them, and then they were like, Charlie. So yeah,
So that's the nicest food you recall
yeah, the nicest
preparing.
food.
Okay.
Yeah.
So who also taught you how to prepare food?
Oh, no one taught me. And then because my siblings are girls, when they are in the kitchen doing it, like I'll just be observing.
So viewers, you are watching is Ken in the kitchen preparing braised rice with 35 Ghana cedis. So Ken, another question for you again. Would you go in for a beautiful lady who doesn't know how to cook, or a mukwi who is a good cook? Who will you go in for?
Well, this question is very tough, but I mean, I'll go in, honestly, I'll go in for the beautiful lady who can't cook. Yeah. I can cook, so there's no problem with that. Yeah.
So viewers, you are watching, Ken is saying instead of going for a mukwi who can't cook, who can cook, sorry, he will rather go in for the pretty lady who cannot even prepare normal tea. So, Ken, why did you take this decision of rejecting the mukwi? Mukwi suye nipa, they need human being. So why did you reject mukwi and you are going for the pretty lady who cannot prepare a food nor do any domestic chores?
I know Mukwis too deserve love, but
Justice for mukwi, justice for mukwi.
but Charlie, me, I want my case to be nice. So yeah, I want my case to be nice.
So Ken is saying the reason why he's not going for mukwi is because he wants his generation to look beautiful and pretty. So why did you take on this particular course? Was it something that was given to you mandatorily, or you went for it?
Oh, I went for it. Yeah, I went
So
for
you
it.
knew about this course
Yes,
already?
I knew about it.
Oh, okay.
Yeah, I went for it. Yeah, and then because of the opportunities inside, that's why I chose it. Yeah.
So let's kindly like tell the viewers some of the job opportunities that they will encounter when they pursue this particular course. So if you are from SHS and you are coming, listen to some of the job opportunities that you are going to get when you read this particular course. So kindly run us through some of them.
So for this program, there are a whole lot of opportunities. Okay, and then you can choose to branch into industrial radiography as well. Like we don't only do health in radiography. You can branch into industrial radiography, forensic radiography. Okay, so like it's not always that you would want to be in the hospital, but choosing to be in the hospital too is very nice because every kind of procedure, surgical procedure that doctors will be taking, like you, the radiographer, you will be there, you will be observing, like you know a whole lot about the human body and all. Yeah. And then if you want to travel outside too with this kind of programs, like it's very easy and then very interesting. Yeah, especially in the UK. Yeah, we have a whole lot of opportunities in the UK, especially when you come to Legon.
We are back, viewers, and we still have Ken in the kitchen preparing braised rice and guamo, aka SK domestic food. So as we are watching, Ken, what's the next thing that we'll be doing?
Okay, so I'm done with the pepper grinding.
Okay.
Yeah, I'm moving on to frying the sausage.
Okay.
Yeah, and then from there I'll continue with the frying of egg as well.
Okay.
And then we are finally done.
Okay, so we are okay. So in conclusion, it's a good course, and you should pursue that course as well. When you find health-related stuff interesting to you, stay tuned. And after we come back, it will be time for judgment. We are back, and it's time for review, judgment. And as you know, the realest person, the realest person you ever see who will criticize or give his assessment on a food. We have other invited guests as well. One roommate, one external visitor who is also going to give his verdict. So as you can see, maybe a much them asan ya rare as so ni 35 Ghana cedis. I don't know who are you anymore. So it's time for judgment. I want you all to get a spoon. Ken, can you give us a spoon? Yes. We are all going to take, let's say, one spoon. If one spoon doesn't give you the actual assessment or judgment that you want to give, you can go in for you can go in for another one. So we will take each and everyone's judgment. Or so in a scale of 1 to 10, we will rate it. So are we good to go? So I'm sure by this time, dear, you have your judgment in your head, whatever. Okay, so let me start.
On a scale of 1 to 10, I'll read this a 7.
A 7?
Yeah.
Okay, so why 7?
Solid 7 because well, I don't like oil that much.
Okay.
So I feel it's a normal, right? But then I feel the oil could be reduced a bit. And then the salt in the pepper too is not giving saltiness. But on one day, the salt in the pepper should be quite salty.
Okay. So this time around, food critics for Amado Sopa, they are giving their assessment, and I like the review. Okay, so let's go.
Yeah, so I'd like to say that with the pepper, it isn't very hot because we all know that with Anguamo, the pepper is supposed to be hot. Yes, and as my brother said earlier, the salt in the rice isn't that much. Yes, but overall, I rate it 6.5 out of 10.
6.5 out of 10. But as a media, the can media to you because like the pepper, okay, or maybe men I mean penny on hot, yeah, but everything is good for me. To me, domestic food there, and what you just prepared with the 35 Ghana cedis, I'm going to give it 8. So you taste it yourself, and you to give your own assessment. So rate yourself, scale of 1 to 10.
Be honest.
Well, honestly, I think everything is on point, but the salt in the pepper was not that much. But it's okay. Yeah, it will be accepted everywhere.
Okay,
Yeah.
sure. So rating yourself, scale of 1 to 10.
9.5.
9.5. 9.5. He was the one who prepared it. He took the pain of preparing this food with 35 Ghana cedis. So viewers, as you are watching low budget cooking, this is the only channel where your greatest or favorite meal will be prepared with a shocking budget. So stay tuned, tell a friend to subscribe to the channel Low Budget Cooking on TikTok and on YouTube. So low budget altogether underscore cooking, and you'll find this great content over there. We are out.
Stay still, we'll be right back.